Okay, I'm Widyastuti from Indonesia. I'm representing the Indonesian Hospital Association, PERSI, P-E-R-R-C in the local language. And I'm here because my organization feels that we need to collect information from this meeting and find out whether we can increase our collaboration with Health Management Asia, especially when we are now facing quite some issues in helping our hospitals under PERSI to do better in the future. This is because we are now having some drivers for having more investment from outside, because our country is close to universal health coverage by 2019, and our healthcare system are not in the stage of preparedness to give everything better to the people.
And so if you've got a target of 2019, then what sorts of things do you think need to be put in place now, I suppose, in order to be able to achieve that?
Yeah, I must tell that in 2014, we launched the system, the National Health Insurance Scheme for all population, but we start with only 120 million people, but now it is already 179 million achieved mid-year this year. And we found that increase of utilization of healthcare is rising very much, but the preparedness of our supply side is not in that capacity that can fill in the need and demand of the people. So we are trying to, evaluation team to do some analysis, and we found that we must call for more collaboration from different countries. And I think HMA is one of the vehicle for us to learn more in a very short time. But then after that, of course, we will do the follow-up to really have the right inputs for our country in the future, especially because of this target of the government to reach universal health coverage by 2019. And our capacity, supply side capacity, is not in that stage. You know, our country is 7,000 islands, only 6,000 inhabited, and there are discrepancies between the center, the island of Java, with about 65% population, while the rest are not at the same rate of development. So we would like, if you talk about universal health coverage, it is for all. We cannot only do something for the Java island. We have to cover all. And for covering that, we are lacking of sufficient financial support and also human resource for health, capacity for quality, giving quality healthcare services, and also to really make it an equitable distribution among the resources to all parts of the country.
And so in order to fill some of those gaps, do you think that you would need to look for partnerships and maybe even technology providers across the broader sort of ASEAN territories?
Yes, I think this is one of our initiative with all other, about ASEAN, 10 countries under ASEAN, and we will move to what we call the Economic Community of ASEAN, actually starting on 2015, but we will be having more concrete activities by 2018 to 2020, and after that 20 to 25, to make it a very solid economic community of the ASEAN, like the European Union in the other part of the world. And we found that other countries like Thailand, Singapore, Malaysia are ahead of Indonesia. We have also some under us, but I think we want to be one community, solid, and at the same time also help each other to be one stronger economic entities.
So clearly perhaps some of those initiatives are a very big undertaking and can obviously take quite a long time. In order to be on track for your 2019 target, what would you like to see happen in just the next 12 months? So if you were here again, hopefully you would be, at HMA 2018,
Yeah. Mm-hmm.
what would you hope you would have achieved by that point?
Okay, I see that our issues, for the national health insurance is about costs, healthcare costs, and the second one is about the new technology, especially digital system, to be the new technology to support us, and also some healthcare technology, like with that new, what you call, new equipment, that I saw quite some knowledge gained in this activity. Yeah, I see that your activity, an annual meeting, used to have collecting these needs and demand from the countries. So I think this is the best place to learn from and to give Hospital Management Asia to think of other countries which are in a little bit behind some other advanced countries to learn from, especially to support the economic community of ASEAN to be established.
And so have you come across maybe anyone here at the show or over the last sort of period of time when you've been working on these projects, are there any other particular hospitals or countries that are very good case studies for the challenges that you're facing in Indonesia?
Yeah, maybe I am a little biased because I saw some session only. I didn't go to all session. One is talking about the instrument, modern instrument from our friends from Germany, like Elsevier also, and also some other, like this morning we heard from the lady from Paula. So it is also give us some initiative to learn more from them. And it's also I saw some people from Thailand, from India even, to give us more insight that there are many things to help us in a quicker way with applying new technology or new intervention that they experienced before.
And so just to ask a little bit more about that technology, is there a technology of choice, for instance, that if you could magically put in place tomorrow, is there a technology of choice that you'd love to see in being utilised in some of the hospitals in Indonesia?
I think the technology that is among the methods to do things, we can easily adopt, okay? Of course, we will maintain connection with the one who has it, like from Taiwan, Thailand, and India. Then, for the other technology, we need, of course, capital to buy, for instance, because it is new technology, new logistic for our hospital care. So for that, I think we must wait because we must collect resources in country, as well as the investment from foreign countries to help us. Okay, so it will take some time, but for methodology, intervention, we will learn better and quicker.
And are you aware of any sort of submissions to the Asian Hospital Management Awards for 2017 for your association or for any of the hospitals in Indonesia?
Mhm. I think you see, our group was very busy with, in fact, now, on these dates, we have two bigger association under our all Indonesia association. One is on the private hospital association, and the other one is on the local government association. They are having the same meeting in Indonesia on the 23rd and 24th also. So I think I would like to actually, if possible, do you have this meeting only at the same month every year?
It will be slightly different
Uh,
next
uh,
year in Thailand.
okay, so early. That's why we were late responding. Uh, Health Management Association, um, Health Management. Mm, yeah, I think it is because that's why our people are divided into several activities, and we were rather late in preparing ourselves to send more people to this meeting. If it is sent to us earlier, I mean, I got it from my predecessor. But if it is sent to the chairperson of the Indonesian Hospital Association, we have 16 sub-associations under us. We will disseminate it earlier, and then we will be more prepared to send more Indonesian to learn from this kind of meeting.
So looking a little bit at the private and public sort of hospital provision in Indonesia, do you have a sense of what the balance is at the moment between private and public hospitals, and do you think that's the right balance?
Okay. In the past, it was not, okay? But then, I think for the last 2 years, because of the National Health Insurance Scheme, we have very quick increase in the private sector's establishment of hospitals. I think now we have 2,725 hospital. It was shown through the online registration, and among these 2,700, we have like 800 local government and central government hospitals, but we have like 1,400 private hospitals. So the number of the private ones is going to rise very quickly because of this system of national health insurance. So in the future, we will see that private hospital will take care, which is also, I think, the need of the community to use more on the private sector, because it is used to be or trusted to be better services compared to the government. But now, government also, our new president is very much putting additional public budget to the public hospital. So I think national health insurance has become the driving force to make better hospitalization in Indonesia, and I think it will be get to the balance, yeah, later among private and public. In fact, some policymakers has already decided on having a public-private partnership better, not like in the past. Now they are really seriously thinking, and some investment policy already changed their way of giving more open areas for private sectors, even foreign sources to help Indonesia.
It's clearly very important that you're working on collaborations within Indonesia, and obviously you mentioned the importance of learning from a number of the other ASEAN countries in terms of progression. And obviously HMA is all about trying to bring a a number of the countries together to share that knowledge. In particular, we have obviously a site visit to a few of the local Philippines hospitals happening as part of the show. And so my final question to you would be, if you could visit any hospital in Asia or across the world, where would you go, or which country would you like to go to, in order to explore a little bit more about what those hospitals are doing, and particularly what the associations are doing to help the hospitals?
In fact, now it is in our program of the Foreign Relation unit that I am leading now. In early September, we will go to Korea, South Korea, because they also invited us to come. So about 7 very high level PERSI board members will be coming there, and we would like also to think of going to China, because China is another big country with this, I think, with successful advantage now, and also to other international meeting, and especially, of course, I think focus on Asia, which is your meeting, annual meetings.